Hi, everyone. Thanks for joining our webinar today, which is about interprofessional education. My name's Letitia Kernigan, and my role is as a rural mental health academic advisor. I'm based in Albury, New South Wales, and my professional background is as an occupational therapist.
Hi everybody, my name is Rebecca Barry and I'm a clinical educator based in Griffith. My professional background is social work. Tish and I are part of the Rural Health Education team at Three Rivers Department of Rural Health, Charles Sturt University. We would like to begin this presentation by acknowledging the First Nations people of Australia, who are the traditional owners and custodians of the lands on which we meet, and pay respect to their elders past and present. We extend that respect to all First Nations peoples here today. And I would like to also acknowledge that these recordings were created on Wiradjuri country and pay my respects to the Wiradjuri people.
Thanks, Beck. So our learning objectives for this topic is to develop an understanding of IPE, interprofessional education in healthcare, to develop an awareness of the benefits of IPE, and to build an awareness of how IPE can be implemented in a rural health context. So firstly, looking at what it is. So what is IPE? What do we mean by that? The World Health Organization has a good definition, which says that interprofessional education occurs when students from two or more professions learn about, from, and with each other to enable effective collaboration and improved health outcomes. So what it's about is about creating a safe collegial environment where students and clinicians can learn, and in essence is collaborative and provides seamless care to clients or consumers. Internationally, IPE has been promoted as a growing area in the undergraduate curriculum to enable students to enter the workforce with an additional layer of skill, which aims to meet the demands and complexities of healthcare. So, internationally promoted IPE in the context of an ageing population, limited financial resources, and the recognition of a need to redesign the healthcare system to improve teamwork between disciplines, enhance quality patient care, and improve our health outcomes. It's the second quote there on the slide. That really encapsulates the why around IPE, why it's important, and the impact that it can have. So IPE, when we're talking about learning that's interactive, whether it's, and that interaction can be in the classroom, in the clinical setting, and even now online. So moving to the benefits, just looking at the benefits. So really the benefits are that we can build collaboration better, practice ready, a practice ready workforce. We can increase an understanding of the expertise of other health professions. It also provides students with real world experience. It enhances skills in communication and in collaboration and in conflict resolution. Opportunities for interprofessional learning about ethical practice, and it also promotes critical reflection. And all of those things together, of course, result in better quality care as well as improved health outcomes for our patients.
Thanks, Tish, they certainly do.
Yeah. So now that we've sort of had a look at what IPE is and what are the benefits, it might be just important just to take a moment to have a look at some of the approaches to healthcare that we see and make sure that we're clear in those terminologies. So just revisiting the basic differences between, say, these three approaches between multidisciplinary, interdisciplinary, and transdisciplinary. So multidisciplinary, we're talking about refers to team members from different specialities who will come together to uh, to to work with an individual, but they remain in their discipline. So, for example, in aged care, we might see that a consumer would see a nurse, a physio, a doctor, and a pharmacist all at different times, but they're all seeing them for very specific issues. They're an MDT team because they still come together, perhaps, and they may have a case conference, so they're working collaboratively, but they are still within their own discipline and owned individual goals for the care that they deliver. So interdisciplinary is a little different. So it's where the consumer is central and all disciplines come together to collectively address that intervention and care delivered by the team, which may be made up by a variety of disciplines working towards, say, a common goal for that consumer. So an example might be if we're doing an assessment with or some therapy with a stroke client, say, so we're doing some upper limb and maybe some lower limb therapy, and can be carried out concurrently, say with an OT and a physio, or it could be carried out just by one of those disciplines, but combining that knowledge and skill and towards the goals, the common goals. So it can be very effective. Because it also reduces duplication in that scenario. It can create more opportunities and therapy time for the consumer, and it provides that seamless sort of transdisciplinary approaches where we're talking about people from multiple different fields coming together to solve a problem, perhaps, or to perform certain elements of a role. So, for example, you might see this in community mental health service, whereby each team member is able to do similar work in relation to assessments or case management, but they may come from different backgrounds. You may see outside of health in the larger context transdisciplinary collaborations where you might see health economics, people from policy backgrounds and design backgrounds and even engineering backgrounds coming together to solve larger issues within communities or within populations. And so that's what we're referring to when we're talking about transdisciplinary approaches. In regards to IPE, I guess it's most applied to and promoted within interdisciplinary and transdisciplinary teams. And we'll see more examples of that as we go through.
Thanks, Tish.
Thanks.
So thanks. Tish has talked to us about what IPE is and many of the benefits of IPE and the different approaches. We have a picture of a silo here, and we know that major errors made working in health often relate to poor communication between the various disciplines, that often there are power struggles about who is in charge and who is responsible, yet we do continue to work and learn in disciplinary silos quite often. So yeah, we do. And we know, as you've pointed out, Tish, that experience and working interprofessionally results in better and safer care. So let's talk about some of the opportunities for interprofessional practice, or IPE, interprofessional education, particularly for students on placement. IPE opportunities can be unstructured or structured. Unstructured opportunities for IPE occur when students from different disciplines are co-located on placement at the one site or agency. So it may be that you have an agency that happens to have two students or more than two students on placement at the same time from different disciplines, and they may even be from different universities. And they may be on placement sitting in a similar area or or at desks next to one another. And this presents an opportunity for unstructured IPE to occur. You know, often the students will have conversations about what their learning is. You know, they might discuss particular cases over lunch and share that learning. So they're learning from and with one another, but it's not a structured opportunity. And we see this quite often, don't we, Tish, with students on placement? Yeah. So the other opportunities that exist are more structured IPE opportunities. And this is when the placement is actually intentionally set up. It's coordinated and set up with a group of 2 or more students from different disciplines. And these students undertake a project together on placement. And so participation in IPE as a formal or structured or planned learning experience works towards the goal of developing the students' attitudes, their knowledge, their skills, and professional behaviours. So up on the screen here, we've got a number of different opportunities that can exist for IPE to occur. And again, these are both can be structured or unstructured opportunities. So we'll just run through these together now. On orientation, you know, or in tutorials or in services involving students from more than one profession, we can see IPE occurring. Team meetings or ward rounds attended by a range of health professionals and students enables IPE to occur as students are standing with one another or learning with one another with a different group of discipline or health professionals involved. Case studies that allow students from different professions to discuss their roles and scope of practice in the context of the care of a client. Case studies are a fantastic opportunity for students to sit together, and health professionals as well, and learn from each other. Observation is another opportunity. So it may be a student observing a health professional from another profession providing care. So you may have an occupational therapy student observing a nurse or a social worker, and or vice versa. And so these are great opportunities. Project-based placements that require input from more than one health profession. Group therapy sessions or home visits that can be delivered by professionals or students from different health backgrounds are other excellent opportunities. And finally, discharge planning meetings. So the discharge planning, it's important that, you know, there is input from different professionals involved in the care of a patient, and for students and health professionals to be involved in that experience. It's a perfect example of IPE in action. So let's just pause and think about, well, we've talked about the benefits of IPE and, you know, different opportunities, but how does it all come together when we're actually wanting to intentionally coordinate IPE? And it certainly does, you know, facilitating a group of students requires additional consideration for those planned opportunities. So designing the IPE placement, we need to consider some core competencies for IPE, which can be summarised into 5 themes, considering roles and responsibilities, ethical practice, conflict resolution, communication, and collaboration and teamwork. These themes are very important considerations when designing an IPE activity, and the outcomes, where possible, should be matched to an assessment task. So all of these themes, you know, can be incorporated in the final assessment task or outcome that you are asking the students to do. The length of structured IPE in clinical settings can vary, and, you know, examples exist of students going on formal IPE learning opportunities or placements between 2 weeks and 6 weeks. The placement needs to be designed with the facility and inclusive of stakeholders. It is important to have facilitators or the supervisors who are committed to IPE. You need buy-in for it to be effective and to work well. A schedule and timeline of activities, an assessment task such as a group project, and a clear outline of roles and responsibilities provides a clear framework for the IPE placement. Evaluation of the IPE activity or placement is integral to improving the design of future IPE placements. And just some tips to consider if you are a health professional or supervisor involved in IPE placements is to consider developing trust with all of the stakeholders involved in the placement. Use students' names and not their role or location. And consider sometimes that a disagreement should not be interpreted as disrespect, just sometimes differing opinion. And that's really important. That's an important part of the learning, is that conflict resolution as well. That's one of the themes I had mentioned earlier. Planning, design and facilitation of IPE is challenging. There's no doubt about that. It does take additional skill and time and consideration, but it's certainly achievable through the creation of authentic IPE activities for health profession students. Preparing the student for an IPE placement. So what sort of things do we need to consider? Perhaps we'll just pause and think about that as health professionals. How would we best prepare students for these non-traditional or different placements? Preparing students, I guess it's important to think about, well, we would prepare students in the same way that we would for a traditional placement. So think about what you would do if you were preparing a student for a traditional placement. And then in addition to that, we would look at definitely having a pre-placement meeting with the students. And in this meeting, we would talk about, what is IPE, the theory behind it, and what are the benefits, as well as discussing potential challenges. But with discussing potential challenges, it is important for the students to know that there is support available to navigate any potential issues that may arise. That's really important. Orientation to the placement, including knowing who is involved and their responsibilities, what the placement will look like, and expected outcomes on the first day can certainly set the scene for a successful IPE placement. And another way to prepare students for IPE placements prior to the placement occurring is to consider, giving them case studies and self-reflection activities, which can help introduce the students to IPE. I just wanted to talk about an IPE placement example, which occurred in a rural clinical setting with 2 nursing and 1 radiography students. This was a 2-week block of IPE. The students were orientated to the placement by learning about interprofessional practice and the benefits for patients and health services. The 2-week schedule provided an opportunity for students to observe and learn about another health profession as they participated in work across different areas of the rural hospital. The schedule that they were given ensured that the students had supervision each day and access to additional learning about interprofessional practice. And this was additional learning that they may not have had access to on a traditional placement. The placement model was structured to enable the students to meet all of their learning requirements and competencies, either during the 2-week placement or in the other weeks spent on placement at the rural hospital. And there are a couple of photos there on the slide from that placement that we wanted to share with you today. And in addition to that, some testimonials from students involved in IPE we have up on the screen there. One of the students said, "I would highly recommend this amazing experience to other students, staff and clinical work sites." Another student said, the placement has been an enriching and enjoyable opportunity for me. I have enjoyed being able to experience other professions' roles and responsibilities within the healthcare workforce, and it has encouraged me to take up a nursing degree alongside my radiography, which is pretty exciting. I was able to develop clinical radiography and some nursing skills during this placement and have been rewarded with a new open mindset towards how we all work together to deliver the best possible outcomes for all patients, which I think really neatly sums up the benefit of IPE there, Tish, doesn't it?
Yeah.
Yeah, particularly that comment about having a new open mindset.
That's exactly right. It does challenge them slightly, but that's where the real learning occurs, and it does reflect the real world practice environment. So it's great.
Yeah, that's right. Interprofessional education and the rural context, it is a wonderful opportunity, IPE, in a rural setting, because those who live and work in rural and remote Australia are extremely well placed to lead the way in practicing IPE. Not because we necessarily want to, but because we're already doing this due to the scope of our practice, and we see this occurring in rural communities and health services all the time, every day. And we have to work as part of a multidisciplinary and interdisciplinary team, especially in remote Australia. So it's certainly IPE, it presents a wonderful opportunity in these communities.
Thanks, Beck. Yeah, so just in summary, I guess, what have we taken from today? So in the discussion, I guess we're hoping that you've been able to observe some, unique and invaluable ways that you can create learning opportunities for clinicians and students, and particularly in a rural setting. And that as understanding that as health professionals, that have been exposed to the real world experience of interprofessional practice, we're better prepared to meet the demands of working in a rural context. So if we offer that to our students, they also then have, they're better placed to meet the demands of working and enjoying working in a rural context. And structured, as we have mentioned, structured IPU does require planning and preparation to ensure its success. And we, I guess, would just encourage that if you would like to continue the discussion or have more questions about IPE, or how you may be able to further enhance those learning opportunities within your workplace, you can visit our website, and you can email us, and we'll be very happy to discuss any of this with you. If you look at our website where you found this web recording, you'll find a link to an evaluation survey. If you complete that, you will receive a certificate for listening to this webinar. And as I mentioned, our website details are there, and email address if you want to get in touch, which we would love to hear from you guys. Anyone out there?
We certainly would. Any time. We love talking about interprofessional practice.
Absolutely. And we've got a list of references there. If you would like just to pause this recording, just so if you wanted to take down any of the details, we encourage you to do that now. Again, if you would like more references, you can always come back and email us again as well. And yeah, we thank you for listening, and we hope that you have been able to use this time to reflect perhaps on your current practice and where you would like to take your future practice, or if you're a student, how you may, what you maybe broaden your perspective of student placement opportunities. So thank you very much. And thanks,
Wonderful.
Beck.
Thank you, everyone. Thanks for joining us today.